which is a great achievement. But taking it back home from where I come from, the problem we have is that the entire structure of the Ministry of Health do not accept that health has any role to play with climate change. To them, it's an environmental issue. But that is just a misnomer, because there are 5 line ministries that should drive the climate change discussions: energy, health, environment, agriculture, and water. These 5 ministries are supposed to be the driver. In fact, they're supposed to be key partners. So when we began our interactions with the UNFCCC, so we became concerned that our health ministry has literature knowledge. So we began an engagement with them from 2009. One, to draw their attention to their role in this discussion. 2, to also see how we can enter into a partnership. Because what you don't have, you don't give. But because of the bureaucracy, a lot of stuff will not happen. But we did not relent. We continue with our activities internationally, and we also continue to engage our government back home. But as 2-3 years ago, we began to have the listening here. But we didn't just stop at that. What we did on our own level was that, yes, we began a training for nurses, an advocacy training. In 2010, we organized a capacity building for nurses, and about 350 nurses participated at the Lagos State University in Lagos. And then we did another one in 2015. And now, when they began to see their relationship, people were kind of, wow, so this is actually happening. So, in furtherance of that campaign, we felt what we lack, where we come from, even though we contribute list of the carbon emissions, we suffer more. It's the fact that, yes, we do not have the knowledge, we do not have the technical expertise for this, which explains how our engagement with the international community. So, by virtue of our membership of the UNFCCC, we are members of the GCHA. In fact, last year we led the side event that GCHA were part, because in 4 NGOs that was in Shan. Now, what we now did was we now began to identify organizations that we believe have the knowledge, have the capacity that can be transferred, and we began to engage with them. So the first one of the entity we reached out to is a group known as the World Continuing Education Alliance. It's an impact technology company that works with stakeholders in low and middle income countries to build capacity in the training of nurses and midwives and other healthcare practitioners. Now, what they do is they use technology. It doesn't have to be on site. It has to be mostly online, and they have different curriculum that they use to develop the capacity of the health workers. Now, we entered into an MOU with them. That was early this year, and the purpose was to also use their facilities to see how we can drive our campaign. Then, following that, we reached out to the Nursing and Midwifery Council of Nigeria. I'm a nurse by profession, like I said. I trained in Nigeria, practiced in Nigeria, retired, then went to the United Kingdom. I practiced in the NHS. But my love for my country, takes me back home regularly. So my activities on Nurses Across the Borders is in Nigeria and Africa. So any advocacy issue I raise at any forum is to advance the cause for Nigeria and the African community. So we reached out to the Nursing and Midwifery Council of Nigeria to see how they can buy in. Why? To see how they can also incorporate the curriculum for nurses that is on climate change. And they're actually interested. In fact, the registrar was supposed to have been here, but it's literally here and now engagement outside of Nigeria. So we are working on an MOU. Now, going to the Federal Ministry of Health, which is the regulatory body of all healthcare practitioners. Of all healthcare practitioners and training in Nigeria, like I said, we're trying to reach out to them. So they've agreed. The current minister has actually, our MOU, as I speak, is on the desk of the Minister for Health, and as I speak, the Director for Climate Change under the Ministry of Health is here with me. That is the matter, Mr. Briggs. he came for the program, and then that is on the level of the federal ministry. Now, but the Federal Ministry of Health or the federal government, they are not as proactive as we expect, so we cannot just wait for them. So we reach out to other state actors. And today, at about 4:45, we are having a side event at the 79 with the Delta State government under the Delta State Oil Producing Area Development Commission. That commission is an interventionist commission. The Delta State is the highest oil producing state in Nigeria and the most polluted state with oil spillage and all what have you. So the state governor and the entire cabinet were interested. We made the proposal to them, and they were prepared to collaborate with us. And in fact, they are here. The entire team of the state ministry is here with the governor, represented by the secretary to the state of Delta State, and that is Mr. Kisley Emo sitting in front there. So now we are not just engaging in what we are saying, but we want to put practicality to it. There's been a lot of rhetorics, there's been a lot of discussion, there's been a lot of commitments. But between commitments and implementation is a very long gap. And so, which is why the stage we are in today is for us to begin to see practical actions taking place. I appreciate the statistics, I appreciate the policies, but as a nurse, is hands on ground. So, which is what we're doing. As a nurse in the United Kingdom, I am one of the leaders of the Nurses Association in the UK. And so, I organize our colleagues, and we go back home for medical missions. And I also try I represent my association at the NHS Climate Change Committee, so to drive this process. So I would want to just end my brief intervention by just leading us to some of the realities why we believe education is key. Education is key in the sense that for nurses, doctors, or healthcare providers, when there are disasters, the front line, the first responders are healthcare practitioners. In 2020, when you had COVID, the majority of professionals that died were nurses and doctors and healthcare who could not excuse themselves from work. But their knowledge in this area is limited, so that is why their capacity needs to be built. So if we have the realities on the ground that yes, disasters are first and foremost considered in terms of their human consequences, people's health is key, imperative for reducing disaster risk and building community resilience. The standard with which we measure any success of any climate change campaign has to do on its impact on your health and my health. So if there are disasters, we're not trying to see the structures we can save. We're trying to see how many lives can be saved, how many people what preventive measures can be taken. So if the capacity of these health care workers are built, they are number one advocate, because for instance, nurses are the largest single health professionals in any health setting. 24/7 they are with the patients, they are with the family. So they will serve as best advocates to this, and then working together with the collaboration we are having right now, we are asking for partners, because while we want to see how we can develop our curriculum, we want to see how we can develop our expertise back home. And so in whatever form we can work and partner with the international community was very welcome. Thank you very much.
Thank you. That is a lot of years of work. And, when we were putting this session together, we were thinking about education for advocacy so that we learn how to do advocacy better. But you can see how much advocacy has been necessary to get this into education. So it's really both of them form almost a sort of circle in terms of their impact on one another. I really thought when I first learned, in 2009, read in the Lancet that climate change is the biggest health threat of the 21st century, I thought I would just walk up to the senior doctors and I would say, did you know that climate change is the biggest health threat of the 21st century? And they would say, wow, Courtney, give me that journal article. I will now insert that directly into our curriculum and we will have it out next Tuesday. I genuinely thought something like that was going to happen, and we are now almost 15 years later, and this is still I am on a rampage to get this into curricula. So we are now going to go online, and again, cross our fingers this works, to hear from Charlotte Kumpa, the Geneva Learning Foundation, of the Geneva Learning Foundation. She is an expert on vaccines and is online. We heard she was having some connectivity issues, and so we may get a video from her instead of a live address.
Good afternoon.
Oh, okay.
I am Charlotte Wu.
Okay.
I have worked for the health of children and families in Cameroon for over 50 years. I am one of more than 5,500 health workers from 68 countries who are connected to share our observations of how climate is affecting the health of those we serve. Going back home to the community where I grew up as a child, I was shocked to see that most of the rivers we used to swim and fish in have all dried up. And those that are still there have become very shallow, so that you can easily walk through a river you required a boat to cross in years past.
Okay, let me hold on.
These are the words of Samuel Chukwumeka Obasi, a health worker from Nigeria. Dr. Kumba Gopi, a health worker from India, said, the use of motor vehicles, cars, bicycles and autos has led to an increase in air pollution, and we see respiratory problems and skin diseases which have an impact on health. Climate change is hurting the health of those we serve, and it is getting worse. Few here will deny that health workers are an essential voice to listen to in order to understand climate impacts on health. Yet, a man named Jacob Charit on social media snapped, since when are health workers the authority on air pollution? Here are the words of Bie Lilian Bandu, a health worker from my country. Where I live in Boyam, the flood from Mount Cameroon took away all belongings of people in my neighborhood and killed a secondary school student who was playing football with his friends. Climate change is killing our community. Cecilia Nwabiwa, a nurse in Nairobi, Kenya, said, I remember my grandson getting sick after eating vegetables grown along areas flooded by sewage. Since then, I resolved to growing my own vegetables to ensure healthy eating. And yet, Robert Moore found this ridiculous, as if my friend who sells fish at his fish stall comes as an expert on water quality. Why such brutal responses? Well, unlike scientists or global agencies, we cannot be dismissed as experts from on high. What we know because we are here every day. We are part of the community, and we know that climate change is a threat it is we serve. We are already having to manage the impacts of climate change on health. We are